The United Nations-led polio vaccination campaign kicked off on Sunday, giving shots to around 87,000 children. Now, the UN's Agency for Palestinian Refugees says the second phase of the campaign will be focused on the south of the Strip. All of the initial shots are scheduled to be administered by September the 12th. And remember, the promise is to immunise 640,000 kids in the enclave. Well, to give us an update on what is this enormously difficult logistical challenge is Rick Peppercorn, the World Health Organization representative for the West Bank and Gaza, not just organising but actually involved in the administering of these vaccines. It's good to have you, Rick. Thank you for joining us. Firstly, this vaccination drive can only happen if these temporary ceasefires hold, correct? So tell us, how's that going at present?
Well, definitely and indeed a daunting task for all of us. Greetings from WHO office in Gaza and Deir al-Balah, which is also the polio emergency operations center. So the task is to indeed reach 90% vaccination coverage of 640,000 children every round for 2 rounds. And we welcome this commitment, as you rightly said, from area-specific humanitarian pauses. And that's why we divided Gaza in 3 zones. So in a central zone, in a southern zone, and a northern zone. Each zone, we will vaccinate for 3 days, most likely another day, 3 + 1. And then we shift to the other zone. And then 4 weeks later, we do the same. So we started yesterday with the southern zone, and the southern zone, the target population is 156,583. Then we move to the south, target population 340,000 kids, and the north 150. So yesterday was a good day. It was actually a successful day. I was not completely surprised because in the Gaza population, there's a high acceptance for vaccination, but I think they came out in their droves. Families, fathers, mothers, etc., with children. I visited 6, 7 of those centers, and happy children showing their left little finger that they were actually vaccinated. And we vaccinated more than 86,000, almost 87,000 children in one day.
This is a remarkable challenge and a remarkable feat that you've been able to get these jabs into the arms of, or this vaccine into so many kids at this point. Tell me, where were these kids coming from? Who were they coming with, and what kind of state were they in?
Well, they're coming forever with their fathers, with their mothers, etc. So today, for example, is the second day, and I went with a few mobile teams. And we went, and maybe you know that from the television road, this endless coastal roads with this endless makeshift camps all over. We went all over in those camps with one of these mobile teams. And everywhere, where we met mothers and fathers with groups of children, I mean, in those camps, almost every child was vaccinated. So we reached a high target. And I think maybe we even underestimated the target in the central zone, because with the recent evacuation orders, the Gaza population is constantly in flux. But I think there is a real appetite for this vaccination. People realize why and how. And again, we should not forget that Gaza always has a very high coverage in routine immunization before this crisis, coverage over 95%.
You are absolutely reliant on these temporary ceasefires holding in order to get as many of these vaccines into kids as you can. What's your message to Israel and Hamas as we speak? And what are the consequences for Gaza and Israel, and indeed surrounding countries, if this polio outbreak is not brought under control?
Well, I think it's the message is, of course, that we have a plan, and all this, it's incredibly complex. I mean, I cannot even describe it. There's 513 teams operational, etc., and every day from 6 till 2, And all the other teams, the managers, they work to midnight, actually, analyzes, monitoring, independent monitoring. I can't even describe how complex it is. I've done the things in Afghanistan. This is way more complex. So the request is very clear. All these pieces of this puzzle have to fit together. And the most important piece, of course, is area-specific humanitarian pauses, which the parties have to stick to, because otherwise, if it wouldn't happen, we will never reach this this target. The children, their parents, everybody will lose their confidence, with the risk that we do not stop the transmission within Gaza, and indeed, like the risk of polio spread out of Gaza. And with the World Health Organization, all member states, we are working to eradicate polio of the world. We have only 2 countries where you have the wild polio virus, Afghanistan and Pakistan. You see these vaccine-derived outbreaks always in areas of strife and war. Children are under-vaccinated. So we have to tackle this problem right on. I want to say one more point. There is a bit of a vibe, a positive vibe about this polio campaign. We are only in day 2. We have 10 more days to go, and then 4 weeks later. And the rest of the health situation is deeply concerning. Only yesterday, I had another WHO team going to the north, bringing fuel, medical supplies, and taking patients out together with PRCS from Indonesian hospital, Kamalat 1, etc. This was the 3rd mission only approved out of 8 missions over the last week. And they came back at 1 o'clock in the morning. Highly dangerous, highly risky, and completely unnecessary. This has to improve. And my other request, of course, is for everyone, this would work much better if there would be a ceasefire and we can make other arrangements. I mean, this is not an ideal campaign. In an ideal situation, you want to go house to house. There's very few houses left. So we make compromises, but we have a workable approach.
Understood. Well, you've delineated very eruditely just the sort of challenges that your organisation and others supporting you are facing. But the numbers at present, as you say, bode well, which is, you know, a small ray of light in what has been such a dark, dark, dark 10 months. Thank you very much indeed for your own work and for joining us today.